Now for Should I Worry, our weekly segment about everything that worries us. This viewer is saying, what can prevent bleeding from ulcers in my stomach? My husband has been in ICU 3 times in a 2-week period over this. Dr. Samadi.
Well, too much acid in the stomach can cause gastritis, and when it becomes advanced, can cause this kind of bleeding from the stomach. So one of the things I would do is, like, I'm sure they're doing this, but talk to your doctors and look for an infection called H. pylori. H. pylori is a bacteria that lives there all the time, but sometimes can cause this kind of ulcer. The other thing that I know Mark will talk about, smoking and alcohol, which I'm sure he's not doing it right now, something called a tumor in the pancreas called Zollinger-Ellison. This is a kind of cancer in the pancreas that can pump in a lot of acid, and they should be looking for something like that.
The valve gets all burned up,
exactly right. So ultimately, they're going to scope your husband, they're going to find the site of bleeding, and they can inject some chemicals, vasopressins, and things that will shut down the blood flow to that area. And ultimately, if it perforates, surgery is the way to go. And I know he's against surgery, but sometimes
your stomach?
It can. And that's when it becomes a real problem. The other thing is, make sure the pain from gastric ulcer could be very similar to heart attack. Always remember that. And I think that's a very...
How about like antacids?
Well, that's where this all starts, Eric.
Yeah.
It starts with acid in the stomach. And you have to do the lifestyle changes we were talking about. Stop smoking and drink less alcohol, and in this case, coffee can be bad for it, and lose weight and have less fatty foods. If that doesn't work and you actually develop an ulcer, which is literally an erosion in the lining, then we look for this bacteria David mentioned, H. pylori. A lot of us have it, but we don't treat it unless it's causing an ulcer. If we find it on an endoscopy and we're treating it along with proton pump inhibitors, things like Protonix, Prevacid, Prilosec, omeprazole, Nexium, that plus the antibiotic is going to wipe this out in a vast majority of cases. If it comes back, you either inject with the medicine David mentioned, or you clip it. We can actually put clips on now, or I'm going to shock him, if none of that fails, you can surgically repair it. And that may be necessary for this guy, because if he's going to have repetitive bleeding, and by the way, this is what you look for out there. You look for blood in your stool. You look for black, tarry stool. And I'm not talking about, brown. I'm talking about tar-colored stool. Or vomiting. If you're vomiting blood, if you feel pain in your abdomen, in your belly, get seen right away.
Can you be on Nexium and those types of medications for too long, and does spicy food lead to this?
Spicy food can exacerbate this and make it worse and make it more likely. And yes, you can be on these drugs for too long. It depends on particular patient, because they can wipe out acid and then it can come rebounding.
And if you're on them for too long, you have to be careful, because some of these medications can also interact with Coumadin, which is a blood thinning medications. So he needs to be off all these medications.
Okay, what's too long?
Depends on the case.
Okay.
If we're treating an ulcer, you may have to be on it for weeks. Okay.